Okay, so we've got an hour and I'll try and cover as much as possible today. Obviously, if you guys have any further questions, then I'm more than happy for you to contact me. So there's a lot to cover. So I'm going to get started. So the purpose of today is to go through the core surgical training application. For those of you who don't know me, my name is Hajra Haider. I'm a neurosurgery trainee, ST2, and I'm based at the Royal Preston Hospital. Prior to starting my run-through training, I was a core surgical trainee. So I've learned about the process and I completely understand all of the hard work that you guys have to put into the application. So I'll be sharing my own experience and I'll talk through the whole process with you. I just want to say over the years, things have changed, but fundamentally, the things are quite similar to when I applied. Okay, so this is a crash course, so we'll try and cover as much as possible. So the purpose of today is to kind of understand what the core surgical training application process involves for 2026. So I'll show you what it looks like on Oriel. We'll talk about the MSRA, we'll talk about portfolio, and we'll talk about the interview as well. So I've had a look at some of the pre-course feedback that people have submitted. And I can see one of the recurring themes is that a lot of people don't really understand the application process. They don't know how to apply for core surgical training on Oriel. They want some MSRA tips and they want to know a little bit more about the interview structure. So we'll try and cover those things today as well. We'll go through the portfolio process as well, and we'll look at things that you guys can do to try and improve your portfolio score. And then we'll go through things you can do to try and, over the next few weeks, over the next few months, to try and improve your chances of getting a core surgical training number in your chosen location and your chosen specialty. And I'll give you some tips on how to prepare for the interview effectively as well. So in terms of the overview of core surgical training, the recruitment in 2026, the application is via Oriel. The MSRA is an examination that everybody who applies for core surgical training has to sit, and it stands for the Multi-Specialty Recruitment Assessment. The portfolio is something you guys will have to submit around January time, January, February time, alongside an index sheet, which I'll show you. And then the interviews will be at the start of March, and we'll talk a little bit more about those soon. And then the offers will be made based on your MSRA and your interview performance. So we'll talk about this breakdown and how your ranking is formed towards the end of the presentation. So this is the timeline. Feel free to take a picture, but this talk is being recorded and I'll give you all guys access to the talk afterwards. So as you can see, we're in October 2025 now. The adverts have opened. The applications are now open on Oriel. So I'm not sure if any of you guys have had the chance to have a look. And I'll show you on my Oriel in a moment so you can see. And then next month is when the applications close. So you've got the 20th of November as your deadline to submit your core surgical training application. So make sure you've got all of your references and things sorted. And then in December, you'll be invited to sit the MSRA exam. And then the MSRA window will be between the 6th of January and the 19th of January. And then hopefully, if you do very well in your MSRA, you will proceed to be invited for an interview. And that interview, the interview invites are usually sent around Valentine's Day, and it's like 13th of February 2026. We're expecting those interview invites to be sent. In terms of your evidence upload, so you'll have a window between the 16th and the 26th of February to submit all your evidence, and then you'll get your scores towards around that time, but they haven't really published an exact time. So then in March 2026 is when you have your interview date. So it's between the 2nd of March and the 11th of March. And then the initial offers will be released a few weeks after that, so the 24th of March. So we won't focus too much towards about offers today because we want to kind of get you to the interview stage. So that's the purpose of, making sure your portfolio is top notch, and making sure you're revising effectively for the MSRA. So in terms of the portfolio structure, so the Higher Education England, Health Education England have released some information regarding core surgical training self-assessment. So there's 4 domains, and you have to submit evidence for each of those 4 domains. So I'm just going to share my screen with you just to show you the Oriel, what you guys might see on Oriel. Some of you probably already um, know what you're doing, but for those of you who don't, this is the vacancy that you guys will be applying for. So the post commences in August 2026. It's duration of 2 years, and this is the recruitment for England, Scotland, and Wales. And you can see at the top it's core surgical training, CT1, ST1. So obviously I'm not applying for this, but I'll show you what the application process is. So you'll have your contact information and then your application form. So there's not a lot of things that you need to submit here, but essentially just looks for your eligibility criteria. And it usually asks for like a certificate of completion of your foundation training as well, which you can find on Horus. And then that's if you've already completed F2. And then they'll ask you a little bit about your GMC license and things like that when you gained a full license. In terms of supporting information, they've asked whether or not you've got less than 18 months of surgical experience, so you have to declare that here. Obviously, if you've got more than 18 months of surgical experience, then it kind of makes you ineligible to apply for core surgical training. And then so that's when you confirm and submit. But obviously within the application process, you've got your references, fitness to practice, competencies, eligibility. So they just essentially just look at your competencies and your eligibility, meaning where you got your degree from, and also your past employment history as well. And then declaration. And then once you've submitted all the information, then you obviously confirm. So make sure you have at least two consultants that are your referees, because once your offers are released, they need to submit the references. So that is just like a quick whistle-stop tour about the Oriel process. So it shouldn't take you very long. In fact, you should be able to do this within, I don't know, in the next couple of days. But just organizing and asking, making sure people are happy for them to be your references is really important. Okay, we'll go back to the presentation now. Okay, so the 4 domains. So we'll focus now on portfolio. So it's different to when I first applied. So when I applied, your portfolio was scored on a numerical scale, whereas now each of the domains are scored based on an A to E. So A being kind of outstanding and E being the opposite. So there's 4 domains. So commitment to specialty, quality improvement, clinical audit, presentations and publications, and teaching experience. Those 4 domains have been unchanged since I applied. We had additionally had a leadership domain as well, but I think the changes are quite minimal. So this is your index page. So this you can find on the core surgical training application website via the Health Education England, which I'll show you shortly. And this index page you have to print and fill out and submit as part of your portfolio, which will be around February time. So the first domain you can see is commitment to specialty, and they've written again there's a second section for domain 1, which means you have to submit a different type of evidence, which we'll talk about. Quality improvement, which is domain 2, and quality improvement, again, domain 2. So one's just looking at the audit, and the second is looking specifically at whether or not you presented the audit. And then domain 3 is looking at your presentations and publications. And finally, domain 4 is your teaching experience. And there's a disclaimer right there, and you have to sign and date it. And that's going to formulate the first page of your application. Okay, so let's go through the portfolio structure. So what I would recommend you guys do is you can do it 2 different ways. You can either make a PDF of the 4 different domains in one document, or you can submit it as 4 separate PDFs after collating all the documents. So what you can do is copy and paste your certificates and your evidence into a Word document, and then export it as a PDF, and then title it domain 1, and then upload it onto the portal. You'll be given very clear instructions on how to do that. So let's focus on domain 1, surgical experience. So there's 2 types of evidence that you need to submit. So first type of evidence is your e-logbook. So we'll talk a little bit about that in more detail soon. And then the second item that you'll need to submit is your letter from your supervisor regarding your surgical placement. So your actual surgical experience. In terms of your second domain, so the QI and audit, for this you may need to submit 3 pieces of evidence. So the first one being a letter confirming from a supervisor that you conducted the audit and your involvement, so the degree of involvement. So it's really important to focus on some keywords, which I'll talk about shortly, when you are drafting a letter that you want your supervisor to approve. And then item 2 will be the slides or the summary of the project. And then item 3 is the certificate or letter of presentation, which in most hospitals you can get from the audit committee. Domain 3, publications and presentations. So you can see that there's different things that they accept. So if you've got a publication of paper, then you need a PubMed ID. They will also accept a letter of acceptance from a journal. And then if you've done a presentation, then you need to show them presentation slides or a poster. And then if you've written a book chapter, then you need to submit a PDF. So that's you can submit any of those 4 pieces of evidence for item 1. So item 2 has to be a letter of acceptance, an attendance certificate from a conference. So whether you did a presentation or an oral presentation or a post presentation, you need to clarify that. And finally, item 3 is a copy of a prize certificate. So if you've won a prize at a conference, it's really important that you submit the certificate for that. Finally, teaching experience. So if you've been involved in teaching, if you've conducted your own teaching program, or you've been involved in medical student teaching, it's really important that you get a letter from a supervisor, and making sure that they've highlighted your involvement. The item 2, so feedback, is also very, very important. You can either do that separately or you can incorporate it into the original letter that you want your supervisor to sign. And then finally, you also, if you've been to an educational event, so for example, you've been to a teach the trainer or train the teacher course, then you need to submit a certificate of your attendance to that. Okay, so let's focus on domain 1. So commitment to specialty. So the first piece of evidence that you need is a verified logbook. So this is really, really important. So you want to get a minimum of 40 cases because you want to be in the evidence level A, which is obviously going to score you top marks. The purpose of that is to basically, it's very easy to get 40 cases. Even if you're not in a surgical specialty at the moment, there's quite a few things you can do that still contribute towards your logbook. So for example, insertion of a urinary catheter, that's a case. If you've been in theatre and you've assisted, so for example, you've even held an instrument or you've helped close, it's really important that you log each and every case because they count. And you need to get this printed. So it's a logbook summary that you need to get printed and signed. So I'll show you how you can do that. So at the moment, the e-logbook website is down, but I'll show you how to get there once it's fixed. So this is your e-logbook. Just bear with me. I'm just going to share my screen again. So this is my e-logbook. So to generate a consolidation report, you go on operative records and then reports. And then you say for you guys, it'll be plan specialty. And then you want a standard report. And then it's normal. And there's no filter applied. So a standard report will basically just give you the frequency of the procedure and list of operations. And then at the moment, you can't generate a report because the logbook, they're having some technical issues, but it should be up and running next week. I've just had a chat with them not long ago. Okay, so I'll just give you an example of a consolidation report, which is actually on the Health Education England website. Sorry, that's just loading. Okay, so let me see if I can share it. Okay, so you guys should be able to see my screen now. Bear with me a moment. Okay, so this is the example that they've provided on the health education website. So you can see this is somebody's pan specialty e-logbook, which they've reported. They've reported 53 cases, and this is their standard report. And you can see the front page is signed by a consultant with their GMC number and the date. This is the consolidation report. So you have to remember observed cases do not count, so you have to have had at least assisted. And you can see the second page is also signed. So the second page is signed. And then we'll go through the audit bit later. So it's really, really important that you get this signed. So I can tell you from my own experience, when I applied for course surgical training, my supervisor hadn't signed the second page. So my score for this was 0, which is obviously not what you want. But because I did so well on the MSRA and I got 100% in the interview, I got my first choice. So even if your portfolio is not exactly what you want it to be, there are ways around it. But ideally, you want to avoid any glitches like that because they can put you at a significant disadvantage. So let's go back to the presentation. So, yeah, so you want to aim for, evidence A, evidence level A, so 40 cases. But just you have to be very, very attentive to the fact that it has to be signed by the consultant, each and every single page. Okay, so then the second part is your surgical experience. So you need an official hospital letterhead letter signed by your consultant. So ideally, you want to have done at least a 5-day surgical taster or 4-week or more surgical elective. You have to include the placement type that you've conducted, the hospital, the dates, the supervisor, their GMC number, and also a summary of everything that you did and the learning opportunities you received, and your the theatre time that you also received from that. And they don't accept letters of acceptance. At the time of application, they expect you to have done at least a taste a week, so 5 days minimum, but they don't have to be performed consecutively. I think this is another very easy one to get. So in domain 1, you should all be aiming for top marks. Okay, so the second domain, this one is a little bit more complicated, but I think it's not hard to get the points in this. So I think it's very important to be attentive to what they're demanding. So everybody wants to aim for the indicator A for their evidence. So you want to be the lead in all aspects of a surgically themed audit. So emphasis on surgically themed. If it's not surgically themed, then the most you can score is B. So a surgically themed audit, and then it has to be a QI project that's demonstrated change, ideally. So you want to show two cycles and a closed loop and present it as well. So the first part of this domain focuses on the actual audit rather than the presentation. So you can see the keywords here: planned, collected, analyzed, implemented change, re-audited with proper QI methodology. So you want to be able to use all those keywords in the letter that your consultant is signing. So you want to ask them to request for them to make sure they include these details, because obviously if you have led it, then you have performed all of those things. So it's really important to have a complete closed loop audit. I think some people get bogged down on, the specifics, but you can do an effective audit in a short amount of time. So if you haven't done one already, you can try your best to try and find an audit that will have a quick turnover. Speak to your colleagues, speak to your consultants, and see if they can provide you with one that you can perform. So you still have time. because you have to remember at this point you haven't submitted your evidence yet. And then, so we want to aim for the best mark. So you want to be the lead. If you're not the lead, then the most you will score is a C. So if you've contributed, I know it's very difficult sometimes to get a decent audit. If you've contributed, you will get a score of C. And then if you've only been involved in one cycle, that's D. But if you've got no evidence of any audit involvement, then that's E. But I think everybody should be achieving for A, aiming for A. Okay, second part. So the evidence required for the presentation side of things is, sorry, for this part, for the actual audit, you need a consultant letter. So remember to include all of these keywords that are in indicator A. A copy of the presentation slides showing your findings and improvements. I think that's quite straightforward. Just submit your PowerPoint as a PDF, so you can use it with like multiple slides on a page, so 6 slides on a page, and submit that as a PDF. And then if it's been accepted for a presentation, then make sure you submit the letter of acceptance. So if you want to score top marks, so you want to be in the indicator level A, then you need to make sure that you have evidence that the change has been implemented and that you've presented the outcomes. So usually when I applied, it was if you presented the outcomes at an international meeting or a national meeting, that would score you the top marks. But in this, you can see they've not exactly specified where you performed that presentation. So as long as you presented it at a meeting, it can be a local meeting, you can still achieve indicator A level evidence. Okay, so presentations and publications. So again, we want to aim for A, although I understand for this one it can be quite difficult. It's very difficult to get publications. So for indicator A level evidence, you should have won a top prize for an oral presentation at a national or international meeting, or be the first author of a PubMed cited research article, not a case report or an editorial. And then a strong, indicator B means that you've delivered an oral presentation at a national or international meeting, and then you're a first author of a PubMed cited case report or editorial, authored, or you've authored a published book chapter. I think this is all very self-explanatory. If you're a co-author, then that will score you an indicator C. And if you have presented an oral presentation at a conference, or your first author for a poster at a national or international conference, that will give you a D. And then if you've not got any of those things, then E. I think most people kind of fit into the C bracket because they have been involved at some stage in some form of publication. At this stage, if you've not already, I'm not sure if they will accept a letter of acceptance, because I think it's been a little bit unclear in terms of the evidence. I know when I applied, it was the same, it was quite ambiguous. So I submitted my letter of acceptance anyway. So if you are struggling to get any publications but have submitted them to a journal and they've sent back a letter of acceptance, then it's really important that you submit that as evidence too. Okay, so for presentations, you can see that they need a copy of your slides. We've already talked about that, certificate of attendance. And if you've claimed a prize, then a prize certificate as well. And for publications, they want a PDF of the article with a visible PubMed ID. And in terms of the PubMed catalogue journals, if you've applied for them, they need a letter of acceptance. So specifically things they'll look for in the letter of acceptance will be the applicant's authorship, the title of the journal, the title of the article, the journal, the date of the acceptance, and the statement that the confirming journal is a PubMed index. If you're submitting a book chapter, then you need to include the ISBN, the cover, and the contents page naming the applicant. Okay, so the final domain is teaching experience. So as you can see, the best level evidence is A. You've designed, organized, and delivered four or more face-to-face sessions as part of a structured teaching program. So you've kind of worked with local educators to identify a teaching gap and created a program with defined objectives. I think this is not difficult to do. I think we're quite lucky in the Northwest. We have lots of medical students. We've got one of the biggest medical schools in Europe. So we can definitely arrange these kind of teaching programs. And it's not something that would take you very long. As long as you've done 4 face-to-face sessions, you can aim for an indicator A level evidence. If you've designed and organized and delivered 4 or more online sessions, so like we're doing at the moment, that would give you an indicator B, which is still strong, but if you're already in the hospital, you should try and aim for face-to-face sessions. And then C would be if you've designed less than 4 sessions, and D would be you've provided regular teaching, or you've completed a learning to teach course, and then E would be nothing. So I don't think it'll be difficult for you guys to apply for the indicator A. I think you just have to be smart with your time, and try and get as many people on board in terms of your teaching as well. And it's not something that you have to do by yourself. You can kind of support each other and work as a team, and you'll still get those points. So help each other out. So evidence that you need for this domain. So you need a consultant letter. So ask a consultant to supervise your teaching program. They don't necessarily have to be there, but as long as you can show them the slides and show them the purpose of it, and they can kind of write a letter for you confirming that what your role was, the dates that you conducted this activity, the consultant's name, their GMC number, and a signature. And then you also need to submit some formal feedback evidence. So this should be reviewed by the consultant, so you can submit this. So you can make like a Google surveys. So you want to give them send your students feedback forms. Obviously, you don't have a minimum number of students that you need to have. So even if you've got 4 or 5, that's more than enough. As long as you can show that there's evidence, there's feedback for each of those 4 sessions, that would be sufficient. And then you can also submit submit feedback in the form of your portfolio as well. I know some certain portfolios. I know in my portfolio, which is the ISCP portfolio, there's something called a teaching assessment. But obviously, if you're an F2, you guys use Horus. So there might be something on there that you can use for this section to show feedback of teaching. For teaching courses, you need to submit a certificate. So Train the Trainer is one of the more popular courses. Before it used to be scored a lot higher, but as you can see now, it doesn't really contribute to very much. It only gives you an indicator D because you're not actively doing anything in terms of teaching. You're more attending a course, which I guess is active, but probably not as active as delivering and designing your own teaching program. Okay, so we're just almost just over halfway through. So we'll focus on the multi-specialty recruitment assessment now. If you do not do well on this assessment, you will not be invited to the interview. So it's really, really important that you guys revise intensively for it, because it is something that you can revise for. Anyone tells you that's wrong is simply untrue. You can study for it. So this year, compared to last year, things have changed. There's no self-assessment scoring. It's something that previously we had to submit on Oriel, but that is no longer the case. So the applicants with the highest MSRA scores will be invited to interview. And each year there's different cutoffs, typically averaging just above 550. For those of you who haven't sat the exam before, is divided into 2 sections. So you have your clinical knowledge section, which is focusing on kind of your clinical knowledge in every specialty. So includes cardiology, respiratory, neurology, obstetrics and gynecology. So basically every specialty. And the second section is the situational judgment test, or the professional dilemma exam. And they combine the 2 scores to give you a total, and that total is used by the core surgical training application team to rank candidates for interviews. And once they've reached the maximum number of people that they can interview. That's where they set off the cutoff score. I believe in the past few years, it has been around 550. So 550, I don't think it's very difficult to get that score, but some people really do struggle. So I'll talk a little bit about things you can do to try and improve your score and things you can do together to kind of support each other. We'll just touch on total ranking. So in terms of your portfolio, this one is assessed during your interview. So this is different to when I applied. So when I applied, your portfolio was looked at the beginning. So you do a self-assessment score, and then based on your your portfolio score contributes towards your total offer score. Whereas in this round, your portfolio is actually part of your interview. So you've done your MSRA exam, you've done really well, you've been successful to get an interview. Then you've submitted your evidence for the portfolio in February on time. And then how they will use that is they will use two of the domains, so two of the evidences that you submitted to ask you questions. So the interview is actually now split into two parts. It's always been split into two parts. So when I applied, it was split into two parts. One part is the portfolio station, and the second part is the clinical knowledge and management stations. The portfolio station this year will be more personalized, whereas when I did it, it was more generalized. So for you guys, they will look at your portfolio. So 10 minutes before your interview, they'll be looking through your portfolio. They'll pick two pieces of evidence and they'll ask you to talk more about them. I don't think this is something necessarily to be scared about because you already know what they can possibly ask you because you're the one who created and submitted the evidence. I think in a way it's an advantage because you've got enough time to prepare prior to the interview to be able to talk about every piece of evidence. And generally, the questions are quite generic when it comes to your portfolio station. And then your management and clinical stations. So these are two structured interview stations. This is one station. No, this is two separate stations. So it's management they'll be assessing your ability to handle pressure and deal with complicated situations. What you would do under pressure if things went wrong. And then your clinical stations will be assessing essentially how you would proceed to deal with a particular surgical emergency or dealing with a unwell surgical patient. Again, these I think are quite easy to prepare for because there's quite a limit to what they can ask you. So kind of the common things that you would see if you are a surgical SHO would be what they would be asking you about. Like, for example, you've been asked to see a patient with right iliac fossa pain, then you go to see them. The interview will be very similar to, the knowledge base that you're expected to know at this stage will be kind of F2 level. So don't be scared about, the unexpected. As long as you have a very structured approach, you will do very, very well. So just sharing my own experience with each of these domains. So I told you before that my evidence I didn't get a very good score because there was like a small error on my logbook. So my portfolio score wasn't excellent. But I scored 100% in my management station and my portfolio station. And then I also scored exceptionally well in my MSRA. So I got a score of 625. So I got my top choice in terms of which specialty I wanted and the core surgical training track that I wanted. So I think if you do very, very well in the interview and you do very, very well in the MSRA, you can compensate for issues if you've got issues with your portfolio. Okay, so this is we're just going to talk a little bit about the interview now. So in terms of your booking your interview, so the offers will be released on the 13th of February 2026, and then they'll be released on a first come first served basis. So it's really important that you are kind of paying attention to your emails, because they will send out an email inviting you to the interview. And ideally, you want to be able to book the interview slot straight away to one that suits you. Some people prefer to have theirs in the morning, some people prefer it in the afternoon. I had mine in the morning. I thought, just I wanted to get it out of the way. Um, and for others, some people are not morning people, so they prefer to have theirs in the afternoon. So if you want that option, if you want those preferences to be available to you, you need to make sure you've logged into your Oriel account straight away to try and pick up those times, because they do go very, very quickly. In terms of the interview platform, so the interview is conducted on Cupacom. It's a very sophisticated system. It's the one that I experienced using as well. Um, it does work very, very well. And before your interview, you'll be sent a link that assesses your device's connectivity. And it'll go through the diagnostic tools to make sure that you've got your Wi-Fi is strong enough, and that they can hear you, and that your camera is okay as well. You need to make sure when you do join the interview, you join 10 minutes early, and then you'll have your ID check. And you have to bring evidence of ID as well, so a passport or a UK driving license. And your interview, obviously, you can't record or share any of the information. Okay, so there's two main stations, but one of the stations is kind of split into two. So the purpose of the first station, or you could have this in any order. So the purpose of the first station would be management and clinicals. So it's 15 minutes, which isn't very long at all. So you'll have one management station and two clinical scenarios. So an example of a management station might be, for example, um, you are a core surgical trainee on call, and you've been asked to deal with, you've been asked to see a patient who has deteriorated following surgery. So they'll go through each step of the scenario with you. What are you going to do? So obviously you go through your A to E assessment, and then they'll ask you maybe an ethical scenario as well. So for example, if they ask you about a child, if it's a child and you suspect a non-accidental injury, or for example, there might be a situation where your registrar is drunk. So they usually try to sneak in like ethical scenarios in the management station, just to test your ability to handle pressure, and your integrity. And the emphasis here is to make sure you're safe. If you're not safe, regardless of how well you've done in the rest of the interview, this station you will fail. So it's really, really important that you're safe, you escalate early. In terms of the two clinical scenarios, so you'll be given two quite basic clinical scenarios. So an example would be something like a patient's presented with a head injury. You've been asked to see them. How would you proceed? As with any clinical scenario, it's always going to be an A to E assessment. But because this is specifically a head injury, they want to assess your knowledge of the ATLS protocol. So you always start your answer by saying that I would assess this patient using the ATLS protocol in conjunction with the trauma team. You have to emphasize that it's teamwork. So for all trauma stations, you need to know ATLS, and you should have a kind of a speech lined up for that, so you don't even have to think about it. So for non-trauma cases, you might get something like an acute cholecystitis. You might get something like acute appendicitis. You might get a patient that's on the ward that's become unwell. So if you've done if you've done a general surgery job, then this I'm sure is something that you might have dealt with before. So for example, you might have a patient who has recently had a cholecystectomy a few days ago and has now presented with fever. Or they're on the ward with fever, they're scoring quite high on their news, and the nurse has bleeped you, what are you going to do? So of course you're going to go and see the patient, and you're going to perform an ATE assessment. You're going to identify things such as, any investigations that you need to do, and you need to make sure you escalate early as well. Just to quickly talk about the ATE, I think you guys probably already know all of this. But it's important that when you are talking about the ATE, you need to physically mention what you would do. So, for example, airway, I would ensure the airway is patent and the patient is breathing comfortably. B, breathing comfortably, their chest is expanding equally, and they're able to speak to me in full sentences, and make sure you've applied oxygen at that point if you're concerned. And at this point, it'll be 100% oxygen via non-rebreathe mask if it's an acutely sick patient. Number 3, circulation. So at that point, you want to make sure you've checked their blood pressure, their heart rate. So typically, they might give you the information there. So sometimes they can bring up the patient's investigation results on the screen. So just make sure you can take a paper with you and a pen as long as you've got not got anything written on it previously. And make sure you've written. So for example, if in a typical scenario, you'll get somebody who's hypotensive and tachycardic, so you're concerned about shock. And at that stage, you need to make sure they've got 2 large bore cannula in each antecubital fossa. You've administered crystalloid solution. And if you're concerned about blood loss, you've activated the major hemorrhage protocol. And then you've also made sure you've taken bloods, including a group and save, coagulation profile, full blood count, urea and electrolyte, CRP, all of those things. And you've also sent off a gas as well if you're concerned about an airway issue. And then D would be GCS, so assess their GCS. You assess their eye opening, their best motor response, their best verbal response. It's really important that you guys know how to formally assess GCS because you could easily be given a neurosurgical case as well in this. So you should be able to identify the GCS immediately. The minimum score that you can get on a GCS is 3. I've seen in the past when I've done mocks with people where they've given me a GCS of 1. That doesn't happen. Okay, so it's really important that you understand what GCS is because they could easily ask you about that. Okay, so that's your GCS, and the other thing that comes in disability is your blood glucose. So if you've had somebody who's more drowsy, it's really, really important that you check their blood glucose because they might be hypoglycemic. And then you also need to assess their pupils as well to make sure they're equal and reactive to light. And then E is everything else. So make sure you've assessed their abdomen. If they've got a surgical wound, assess their surgical wound. So they might tell you that, oh, the wound looks like it's a little bit red, and there's a little bit of pus just around it. So then you're concerned about surgical site infection, which is a very, very common thing that people get in hospitals, and it could easily come up for you in the clinical scenarios section. Once you've gone through your assessment, they'll give you some answers in terms of the questions that you ask or the investigations that you ask for. Whenever you're asking for investigations, work from the patient backwards. So, for example, you want to do, if you've done your A2E assessment, you ask for a set of observations. If it's somebody with abdominal pain, you want to make sure you send off a urine dip. If it's a wound issue, then make sure you send off a wound swab. If they've got a cough after surgery, sending off sputum if they've got a productive cough. And then work your way backwards. So then you can think about laboratory tests. So things like blood tests. So you want to do a CRP, full blood count, urea and electrolytes. Post-operatively, some people can develop AKI, so that's something to be attentive for as well. And then you can move even further back. You can think about scans. So in somebody with possibly pneumoperitoneum, you might want to do a erect chest X-ray. If somebody you're concerned about a post-operative pneumonia or hospital-acquired infection, then you can do an X-ray for them. If you're worried about somebody with bowel obstruction, you can start with an X-ray, and if you're very, very concerned, then a CT scan. So then radiology comes into play. Regardless of all of those investigations, if you've got an acutely unwell patient, fundamentally, you need to first stabilize them. If you're very, very concerned and you think they're peri-arrest, you need to immediately call the crash team. And in terms of if you're concerned that this patient is sick, you need to inform your registrar. That's not something you should be dealing with by yourself. You always need to inform a senior when you're concerned about a patient. So making sure you escalate early. In your scenario, they might say, oh, the surgical registrar is not available. And then you say, I'm going to contact the on-call surgical consultant. It's the middle of the night and the surgical registrar is not available. He or she's operating. You're going to call this on-call consultant. Then they'll say, oh, the consultant's not answering their call. Sometimes there's a second consultant on call. You can try the second consultant. If that fails, then you still have somebody that can help you. So you can always call the medical registrar on call, and they can help you, particularly with the medical scenarios. Other things you can do is you can call other hospitals where they have a surgical registrar on call. So for example, if you're at the Preston Royal, you can call somebody from Blackpool, or even the Manchester Royal Infirmary if you need specific advice. And um, if you're concerned about somebody being critically unwell, and you're not being able to get to your surgical seniors, it's really important that you let the anaesthetic team and the critical care team know as well, so they can formulate a senior can come and see them, and they can formulate a kind of a safe plan for them. And then in the portfolio station, this is more generic. Sorry, I know I've gone through a lot of things there. But they're all really, really important things. So for portfolio station, this is a 15-minute station. So typically they will ask you to do a 3-minute presentation. So with this 3-minute presentation, when I had my interview for core surgical training, I had to do one on leadership and how I'm a successful leader. So this usually they give you the title prior to your interview. So in your interview brief, you should be given a title. You do that 3-minute presentation. And then following on from that, you'll get a few minutes of question and answers. So they might ask you specifically about something that you've mentioned in your presentation. So make sure everything you talk about is something that you can back up and talk about. And then the 2 portfolio questions will be based on 2 pieces of evidence that you've submitted as part of your portfolio evidence. So for example, if it's an audit, they might specifically ask, okay, what was your involvement in the audit? What do you think you achieved from this audit? How did this impact on your ability to work as part of a team? So they're kind of looking at very typical kind of characteristics of a colleague that they want to work with. So they might ask you things like, do you work better as a team member or as a leader? So you need to give kind of a smart answer for that. So typically you want to aim for answers between 1 minute and 2 minutes. Kind of the sweet spot is usually a minute and a half. So for each of the stations, you'll have a different number of assessors. So for the management and clinical station, you'll have 2 assessors. So they'll be on screen. So on the Cupercom system, you'll see 2 separate people on the screen, sometimes third person, usually sometimes they have a lay person, just making sure the whole process is fair. And then in the portfolio station, you'll have 3 or 4 assessors, and again, possibly a lay person. So if that makes you nervous, I think one of the things that helped me in that situation when there were lots of people looking at me on the screen is I'd focus on myself, so I'd focus on my video. And ideally, when you are doing a online interview, you want to kind of look at the camera. So looking directly at the camera is the best way to maintain eye contact. So kind of ignore everyone else if that's something that helps you. If it doesn't and you prefer looking at the people to stay engaged, then do that. That's completely fine. But if you want to, show that you've got, good eye contact, then it's important to look directly at the camera because it makes them think you're looking directly at them, which is quite hard online. So I guess you have to do whatever you can. Okay, so in terms of your interview scoring, there's a few different domains they'll be looking at. So for the management question, they'll be looking at your probity, your judgment, and your communication. So in the management section, we kind of talked about some of the ethical issues that might come up. So in this situation, with the management situation, so if, for example, you've got a drunk consultant, they want to see your probity, they want to see your judgment, they want to see your ability to understand the importance of intervening in situations where patient safety could be compromised. So it's really important that you kind of got a structure. So if patient safety is being compromised, you have to take that colleague away from the working environment, and in that situation, you physically have to make sure that they're not anywhere near patients or treating patients. And at that stage, you do have to escalate because that's not something you should be dealing with by yourself. Because obviously that's a very, very major probity issue. Other examples in the past had been things like you see a colleague with something that looks like cocaine fall out of their pocket. or you see a colleague look at inappropriate content on their on a work computer. Um, Other things like you hear a colleague say something inappropriate to another colleague, and things about a non-accidental injury on a child, safeguarding issues. So all of these things you should be aware of, things you probably deal with on a day-to-day basis anyway. But in the context of the interview, you need to kind of have a structure. Other things they might ask you to do in the management station is break bad news. So some of you guys might have heard of the um, acronym SPIKES. So that kind of it gives a kind of a structure. I won't go into too much detail, but it gives a structure of how you break that bad news. And then in terms of the clinical questions, they want to assess your ability, your knowledge. So for example, if it's a patient with acute cholecystitis who's had a cholecystectomy now, and a few days later they've become sick, which what you think is a surgical site infection, they might ask you specific questions about how you deal with infection, what antibiotics you would provide, who would you want to involve. So think about things you would do on the ward, like talk to microbiology, send off a wound swab. So things that you would do on the ward. It wouldn't be something that you've not dealt with before, especially if you've done a general surgery job. Prioritization as well. So sometimes they can give you in a clinical scenario 2 or 3 separate cases, and then you decide which patient you want to see first. With that, they're assessing your ability to judge and prioritize and triage. Um, I think they won't give you something very difficult. They would give you something where you know that this is the sickest person. So you go and see the sickest person, but over the phone you can offer advice for the other 2 patients while they're waiting to be seen. So for example, if you get somebody who's not as sick, then maybe advising the nurses on things they can do while they're waiting for you to come and see them. In terms of portfolio questions, they're assessing your knowledge, the content of your portfolio, and your presentation skills. So in the presentation, especially the 3-minute presentation you have to do, they're assessing your communication skills. And basically your ability to communicate. So it's really important that you practice as much as you can. In terms of the scoring, a score of 0 will be, if you've not shown any evidence of kind of probity or judgment or communication, and then 6 is outstanding. So ideally you want to aim for the outstanding score. So in terms of resources, there's lots of resources online that you can use. I personally focused on using my own notes, which are now e-flashcards. So I work with this company, MSRA Pro. I'm sure I've mentioned this with you guys before, and quite a few people emailed me about this. So I'm afraid they have their own email address. There's an admin team who deal with all of the inquiries. So if you could forward your inquiries to them, they have a lot of resources that you can use. So e-flashcards is something I helped design. It's got my notes from the MSRA, which helped me score a very, very good score. So like I said, I got a score of 625, which helped me get interviews in every specialty I applied for. And it helped me kind of overcome the portfolio issue that I had in my core surgical application. If you use this discount code Preston25, you will get a discount on all of the products that they offer. So at the moment, the e-flashcards are available to pre-order, and they'll be ready, I believe, the first week of November. And then for the interview, they also do, which I did last year, is the one-to-one mock interviews with feedback and a portfolio review. So it'll be exactly structured the way your real interview will be structured. Obviously, if you're interested, please email them. And then there's also going to be an interview course, which will be in February 2026. This is an example of some flashcards from the e-flashcards for the MSRA. Feel free to take a picture of this if you want, and you can contact them via support@msrapro.com. Okay, so that concludes the talk. I'm sorry, I know it was a lot of information. Do you guys have any questions? I can stay for a few minutes. Okay, I can see there's some questions here. Okay, regarding evidence, can we build our portfolio till Feb, or should everything be done before application deadline? Ideally, you want everything done before the application deadline, primarily because you don't want they haven't specifically said, but ideally you want everything submitted prior to the application deadline. So if you can get all of this signed and sorted before the 20th of November, that would be ideal. Obviously, if you can't do that, you can still submit it at the date that you've actually completed it. Because technically they've not asked for a self-assessment score, so this is quite ambiguous. So what I would recommend is, if, for example, you've already got it, that's great. But if you haven't, then it's absolutely fine for you to submit it as if you're submitting it for February, because technically that's the only time they'll be asking you for the evidence. If we have an account already in med school for foundation training, do we need to open a new one? For Oriel, no. Your old account should still be active. Do you need both item 1 and item 2 for domain 1? Let's have a look. So for domain 1, you need both item 1 and you need both and item 2. So you need a logbook and a logbook, validated logbook, and also a letter from a supervisor regarding your surgical placement. Must all 3 items be provided for each domain? So depends on what you've done. So if you've done a QI project and it's a complete closed loop audit, you can use the item 1 and item 2 you can combine. So the letter from your supervisor can confirm that you have also presented this at a specific meeting. But if they've asked you for the slides, then ideally you should give them. And clearly, this is from the Health Education England website. They've asked for the slides, so if you've got them, then submit them. Can you please list some of the procedures we can list in e-logbook if we don't work in surgery now? Um, okay, so there's quite a few things you can log. So I said urinary catheters. If you're not in a surgical specialty, that can be quite hard. But if you're in things like gastro, things like an acidic drain, acidic tap is included, a lumbar puncture as well as if you're in neurology. Other things, so catheterization is very easy to get. So if you can get catheters, that would be ideal because we do them on the ward all the time. Um, I think it's quite hard if you're in a medical specialty because you're not really doing that many procedures. So what you might have to do is be smart and just see if on days when things are quiet to ask whether you can go to theatre. So in Preston, I was formerly working in the ear, nose, and throat team with the ear, nose, and throat team, and their cases tend to be quite short. So if you know somebody from the ear, nose, and throat team, you can request to join them in theatre, or if you're doing a medical specialty, you can ask to join in one of the clinics. So sometimes they do things like bronchoscopies in respiratory clinics. So if you're involved with that and you're assisting with that, that's also included as a case. So make sure you're trying to make the most of it. What I would recommend is in your e-logbook, have a look through the options that are presented on there. And sometimes you'll be surprised to see that there's certain procedures that you wouldn't consider as surgical cases that are cases on there. But you just have to be smart about it. You can definitely get those 40 cases. I think it's definitely doable. You've got a month, and I think you probably got more. You probably got more than you think. It's just about being able to maintain them. Official letterhead, does that just mean adding a logo to Word? Does it have to be printed on a letterhead paper? Okay, so if you're getting a consultant to sign or write a letter for you, usually it's their secretaries who will prepare that letter. So what you can do is write a draft and ask your consultant to review it. And then once they've reviewed it, you forward it to their secretaries and they will print it as an official letter and then get that signed by the consultant. So the secretaries usually deal with that section. So that will be the official letterhead essentially. Let's say if I had 2 sessions of teaching for geriatrics and 2 sessions for general surgery, can that count as more than 4? Yes, if you've been teaching medical students, but the thing is you need to get one supervisor to sign you off for both of them to include it as one teaching program. It doesn't matter what specialty you do it in, you can still, say that is under the same teaching program, as long as it is under the same teaching program and it's one supervisor who signed it. Because you're limited to how much evidence you can provide. So if there's two consultants involved, and you've got two separate letters, what they'll do is they'll use the first letter that you've submitted because you're not allowed to submit more than the evidence that they've requested. Is it advisable to do ATLS prior to interviews? No, you don't need to do ATLS prior to interviews. I didn't do ATLS when I applied. ATLS is quite straightforward. As long as you understand the structure and how to utilize it, it's not something to feel anxious about. It can be applicable to basically every trauma scenario that you'll be given. You most likely will be given a trauma scenario. So yes, you need to completely understand the ATLS protocol, but you don't necessarily need to attend the course. The waiting time to attend one of those courses is over a year, so it's really hard to get onto the ATLS course anyway. But don't stress yourself out if you haven't done it. If we will have questions, can we use the group? Yeah, you can use the group. Ideally, actually, I think I might leave this group. You guys can, in fact, I'll leave this group. I'll leave this group next week. So you guys, you've got enough time if you think of any questions to post on there. Otherwise, you can email me as well. You can find me on if you're at Preston, you can find my email. In fact, I'll post it here as well for those that are not at Preston. Okay. Can you list the procedures considered an ED for logbook? So in the emergency department, you'll be very lucky because you'll get lots and lots of procedures. So things like if you've ever seen somebody who's had hip fracture, sometimes they do a block. So if you've been involved in doing a nerve block for a patient with a hip fracture, that's a case. If, for example, you've been involved in a shoulder dislocation, things like that, that's a case. If you've done a ring block, so that's a case as well. There's multiple other situations where you might be asked to suture somebody's skin, close somebody's skin. That's a case. And I think there's quite a few. You have to be smart about it. What I'd recommend is every procedure that you do, you log. Sometimes you can log it as other, but you have to be mindful that they won't always include other if every one of your cases is other. So you have to be very specific about what you're including. When will they release the MSRA score again? So I'll just go back to the timeline. At the moment, they haven't released a specific date. But I believe the people who applied for core surgical training tend to get theirs a little bit later than everybody else. GP people get theirs first. Then I think it's the people who apply for anesthetics and emergency care. And then I think it's core surgical training. So it might be a while before you get your results, but it will be roughly the time when interview dates will be released. So if you sit your exam on the 19th of between the 6th and the 19th of January, you should expect the results within the next 3 weeks of sitting the exam. Well, would you recommend the letters and evidence to be prepped and ready for submission now or in February? Ideally, you want it all ready now because you don't really want to be dependent on the future because anything can happen. But obviously, if, like I mentioned before, you haven't got all of your evidence, then you need to make sure the evidence that you do have is ready because sometimes it can take a long time to get things signed from your consultant or your supervisor. So for that reason, I would recommend you try and get things done now so they're ready to be submitted in February. And remember, Christmas is coming up, so consultants are going to be busy. Can you get two consultants' signatures on one letter? Yes, absolutely, you can. Obviously, if both consultants have been involved and the letter is from both consultants, then yes, as long as they've approved what's written on there and they've signed it. Any other questions? Thank you. No problem at all. So you guys have my email. and I'll be in the WhatsApp group for a little while. If you guys, I mean, best of luck with everything. If I'm not in touch with you, but you know, I've mentioned some of the resources that I'm involved in. So over the past few years, I've worked very closely with the MSRA Pro team, and the one-to-one mock interview sessions are very, very useful. So if you guys decide that you want to be on them, there's quite limited spaces. So if you want to reserve your place, you can reserve it now. And obviously, if you are unsuccessful in getting the interview, you're not paid for anything. So if you want to sign up for that, you can do that now. And there'll be a course as well, which well, a few of us run, but I ran it last year. And yeah, so yeah, feel free to contact this email. I've received loads of emails about the flashcards on my NHS email, so I'm really sorry I didn't respond. So for everyone who wanted the details, those are the details, and they'll get back to you faster than I could. So yeah. Thank you, everyone. I hope you have a nice evening.